Good afternoon. Today's session titled Artificial Intelligence and Regenerative Medicine. I'm Katya, Ravid. I think the title of this session, as well as of the previous one, speaks to the mission of the CTSI to promote interdisciplinary research, and has been so for a while now. So I want to start by introducing platforms that we have developed over the years to promote interdisciplinarity. The Affinity Research Collaboratives, many of you have heard about it, but for you that did, it will be a little bit of an update. So breakthroughs happen when great minds come together. You probably have heard this slogan before, but we truly believe in it. Team science really matters. If you look at studies that were published already in 2007, 2008, of meta-analysis of over 130 studies, focusing on about 20 million papers and 2 million patents, surveys over 5 decades, show that team science increasingly dominates solo authors in the production of knowledge, and knowledge being judged by papers, patents, discovery, and so on. So we were aware of it back then, and we knew also that there are barriers to successful team science. For instance, geographical distance, different departments. How do you bring engineers and biomedical scientists together? Cultures in different disciplines and campuses. For instance, Charles River campus has tenure, medical campus doesn't. So it creates a little bit of a difference. Insufficient role models and examples of successful team science was also a barriers or a challenge. And rewards and promotions, what's in it for me? Some faculty would say, what's the incentive for team science, right? And institutional recognition. And we believe that we have overcome many of those barriers through developing those Affinity Research Collaboratives, or ARCs. They were developed by the Evans Center for Interdisciplinary Biomedical Research and the CTSI, and later on in 2015, also supported by the BU Interdisciplinary Biomedical Research Office based at the Office of the Associate Provost for Research. So we do believe that such ARCs are antidote to barriers in team science. And so what are ARCs? You can read. So those are assemblies of investigators, at least 5, from at least 3 different disciplines, bound by common interests and ability to develop new research areas. It could be new to BU or new period, and relevant to human disease. So in order to facilitate the formation or the development of such ARCs, we also envisioned and developed what we call pre-ARCs. Those are groups of investigators that can come together, meet with me, with other senior faculty for input. During that time, they meet to really brainstorm. And the center provides funding for workshops, invited seminars, and speakers. So from a pre-ARC, transitioning to an ARC, we have what I call an NIH type review, where we have really capable reviewers taking into account a variety of criteria, which we have posted. And if selected, such an ARC will be funded for between 40 to 80K per year for up to 3 years. This is really significant, and particularly nowadays with the funding climate. It really allows investigators who come from different disciplines to develop new research areas and innovative research, which otherwise would not be funded by NIH. So how do Affinity Research Collaboratives forms? I want to emphasize the orange box there. It's mainly a bottom-up approach, which is that faculty from different, throughout Boston University, from different departments, would come up with an idea, and we will provide mentoring and support. Although there have been cases, maybe 20% of our ARCs were suggested by us as a center, but it was primarily through a bottom-up approach. Over the years, we developed what we call ARC Point 2, by which 2 different ARCs will come together and fuse to create even new integrative research. For instance, the ARC on mobile and electronic health, collaborating with an ARC focusing on a chronic disease, and together really forming a new language. So really on our way to integrative research through forming such groups. We are also working on regional ARCs, which is another form of an ARC, by which investigators from BU and other CTSIs, neighboring CTSI, would be working together to develop a new area of research. Just to show you how inclusive we are in terms of representation of departments and schools, in 2024, campus participation is shown here from Boston University School of Public Health, Charles River campus, and this is from monitored from 8 different ARCs that we have right now. Those are examples of ARC research areas that have been developed over the years. AI machine learning in aid of imaging, one of them. Mobile and electronic health now, again, focusing on chronic disease recently. Neurodegenerative disease and different applications coming really from AI to molecular to genetics. Thrombosis and hemostasis, computational approaches to the microbiome, and so on and so forth. Just a little bit of metrics, because we really believe in metrics, and we do so on a yearly basis. During 2016 to 24, about 1,180 ARC collaborative publications were recorded. They have to have co-publications of ARC members. And out of 979 grants applied, 448 were funded, which is nearly 50%. This is a record, we feel. So novel research through interdisciplinary ARCs, we found over the years, is more efficient in resource use by sharing resources, technologies. We have had examples of advancing methodology, expanded funding opportunities, and I will show you some examples. And I did actually show you 50% funding rate, contributing to training, because each of our ARCs includes trainees, pre and postdocs, develop new research disciplines, and I will show you some examples. And also it really helped recruit faculty, knowing that there are such platforms to which they can contribute and be part of. I will end by some examples of outcomes, and I wanted to start with the iPS cell bank, since it's the title of the session today. And the directors of such ARCs are listed in each case in black, so you're welcome to read them, of which we have here Dr. Cotton and Murphy, I think one of the participants. And such an ARC was one of our first one, very successful. And I think that they also recognize that it was really the first seeds that had allowed to promote the development of a new center for regenerative medicine. Another example is the nanotherapeutic platform for cancer and vascular disease ARC, which gave rise to new nanomedicine programs and new master programs in science in nanomedicine. System biology approaches to the microbiome research also gave rise to Boston University Microbiome Initiative, which is a formal initiative right now. Neurodegenerative disease, focusing on Alzheimer's disease. We have a U19 precision monitoring assessment in the Framingham Heart Study funded through the NIH with $19 million, starting as a simple, fun, collaborative ARC. The thrombosis and hemostasis in health and disease ARC, which I happen to co-direct, also was able to develop into an NIH-funded, American Heart Association funded center in cardio-oncology in collaboration with the VA. And we are really pleased that Dr. Terry Keane is here with us today and really a leader, a co-leader of the CTSI. So to wrap up current and future plans, we have ongoing ARCs, ARC version number 1, number 2, I mentioned some examples. And really the goal is to promote interdisciplinarity through integrative science, through at least 2 different disciplines, so that those disciplines really share perspectives, knowledge, methodologies, and bring discovery together. So we were very pleased also to hear of the plans of the BU president and of the new provost of promoting what is called conversion science. It's an interesting area, and I thought that, I will just remind the definition, because it just, per definition, it is a challenging goal. It's to integrate multiple areas of science via the cooperative work of researchers from different scientific backgrounds until theories, knowledge, methods, challenges, and even vocabulary words are intermingled. Good luck. It'll be fun, though. It'll be fun. And it's a fantastic initiative. Towards that end, we have developed, or we are developing what I called arc convergence, using the C of the arc to convergence, to expand interdisciplinarity on the root of convergence, such as thinking and building together a group around law and ethics of AI, biomedicine, and using one disease or chronic disease as an example. Finally, I would say that we would love to collaborate with the College of Arts and Science as they develop the new CAS knowledge nexus designed to encourage interdisciplinary collaborations. So you're all invited to join an existing ARC or collaboratively develop your own ARC. And ARC application renewals for this year are due on April 29. This is the link to it, and you're welcome to email any of us. Thank you, and I will pass the baton to Dr. William.